Hello, my name is Dr. Pamela Cunningham with happyhealthychildren.org. Thanks for joining me today. I wanted to talk to you a little bit about breastfeeding and its benefits for both mom and baby. For those of you who haven't seen my videos or been to my website before, I'll give you just a brief background about myself. I am a Harvard-trained, board-certified medical doctor who started happyhealthychildren.org to provide parents with scientific information that will help them raise happy, healthy children. Basically, today's modern society is so full of toxic elements like the high amounts of screen time that kids are getting or the ultra-processed foods that the kids are eating. Happyhealthychildren.org is a resource available for parents to give them information that will allow them to step aside from those toxic elements of today's modern society and raise truly happy, healthy children. So again, today's topic is breastfeeding and its benefits for both mom and baby. The first article I wanted to share with you is the long-term public health benefits of breastfeeding, and this article was published in 2016. I want to show you these articles in case you're interested in reading more about the subjects. You can just look them up online. But again, the long-term public health benefits of breastfeeding. And what this article does is it reviews a lot of the data out there on the benefits to both mom's health and baby's health long-term of breastfeeding. The first thing it discusses is the cognitive development of baby. So what is cognitive development, first of all? Your cognition is basically your ability to think through problems. So when we are using our cognition, we are able to think through problems, to understand problems, and to get to a resolution of those problems, to resolve those problems. So you can understand how important cognitive development is and is going to be for our children and throughout their whole lives, really. What this article discusses is that cognitive development has been shown to be improved by breastfeeding. We want our babies to be able to have the best, clearest thought processes that they can have so that they can have healthy lives and healthy jobs and healthy family situations, be able to understand what people are telling them and to communicate clearly back to people and come up with resolutions to problems. So what else does this article show aside from improved cognitive development in babies who are breastfed? It goes through the medical benefits of breastfeeding to both mom and baby, and they're really quite extensive. We often hear that babies who breastfeed are healthier than babies who don't. While that is true, I want you to understand the full benefit of breastfeeding to both mom and baby. It's not like baby just, isn't going to have as many runny noses as they would have otherwise had you not breastfed. But the benefits are even much greater and much farther lasting than just the sniffles, preventing the sniffles. This article discusses how babies who breastfeed and moms who breastfeed, babies who are breastfed and moms who breastfeed have lower rates of diabetes, both type 1 and type 2, lower rates of obesity, lower rates of hypertension or high blood pressure, lower rates of hyperlipidemia, lower rates of cardiovascular disease, which is one of the #1 killers in this country, and lower rates of certain types of cancer. So the health benefits for both mom and baby are very extensive and are both short-term in terms of keeping baby healthy and out of the hospital with colds and flus, but also long-term in preventing these very serious diseases that most Americans end up suffering from. So we start to see, just based on this first article, really the great benefits to both you and baby of breastfeeding. The second article I wanted to discuss with you is called Early Nutrition Influences Developmental Myelination and Cognition in Infants and Young Children. And this article discusses myelination in children who are breastfed for at least 3 months. So in order to better understand the implications of this article, let's talk about what myelin is and why it's important. Myelin is basically a fatty substance that surrounds the axons, which is a part of a nerve, and allows information to be transmitted faster than it would be ordinarily within a nerve cell. So if you can imagine like you or your child hopping down the road, hopping, versus slowly walking 1 foot in front of another, 1 foot in front of another, you probably would get to the end of that road a lot faster if you're doing the fast hop rather than the slow walk. Cells that have myelin or myelinated cells are faster in transmitting data than cells that don't have myelin. What this article showed is that children who were exclusively breastfed versus formula fed for at least 3 months have significantly improved overall myelination and also increased general, verbal, and nonverbal cognitive abilities compared to children who were formula fed. So this is a very significant finding. The way this study was done was that the authors of the study looked at the MRIs of children who were breastfed exclusively for at least 3 months. So it's pretty heavy duty science. They were actually looking at very objective findings on the MRIs of the brains of these children. So this data would be hard to refute. It's pretty solid, and again shows us one of the reasons why breastfeeding really improves cognitive abilities in babies in the short and the long term. So the final article I wanted to share with you is the psychological effects of breastfeeding on children and mothers. So we've looked at some of the medical reasons why it's good to breastfeed, again, for both baby and mom. We've looked at the improved cognitive development of breastfeeding for baby, but let's also look at the psychological benefits to baby and mom of breastfeeding. What this article shows is that in children who are breastfed, they have, again, it shows improved cognitive performance, but also improved socio-affective responding. So they are better able to respond in an appropriate way to those people who are around them. They're better able to respond appropriately to their caretakers. And this is something that really helps the bonding between parents and children or other caretakers and children, is when children are more responsive to cues from their parents or their caretakers. So what are the emotional or psychological effects on mom of breastfeeding? Well, what this study showed was that in mothers who breastfeed, you see significantly reduced psychological and subjective stresses, a positive affect or a positive mood, and improved maternal sensitivity and care. So moms who breastfeed actually have lower amounts of stress, improved moods, and improved sensitivity and care towards their infants. So what are reasons why moms aren't breastfeeding? One of the most common reasons why women aren't breastfeeding nowadays is just our busy schedule. Whether they're working full-time outside of the home or they have to go to locations where they're not able to breastfeed their child in public, or they're not able to bring their child there even during this COVID era. A lot of moms nowadays are not breastfeeding because of these hectic schedules that they're maintaining. Remember breast pumps. Breast pumps are such a great tool for those of us who can't be with our babies 24/7. When I had my first child, my son, I was working full time and I wasn't able to breastfeed him actively while I was working, of course. So I feed him as I was putting him to bed, and then I would stay up late in order to pump and have extra supplies for him when I couldn't be with him. But I had that breast milk available for him, and although it was totally exhausting, it was well worth it because it was the healthiest option for him. So remember breast pumps. There are so many great options nowadays for breast pumps. There are portable breast pumps that you can take with you at work and pump while you're there. There are dual breast pumps that you can use on both sides at the same time, so you can have the maximum volume for less time spent. Another reason why moms give nowadays that they don't want to breastfeed their kids is for cosmetic reasons. Moms are concerned that their breasts won't be as full in appearance as they were before breastfeeding. This is an example of the toxic modern day culture that I was talking about earlier that doesn't allow us to raise the happiest, healthiest children that we otherwise would be able to raise. Remember when you see your friends' pictures on Instagram or Facebook or whatever social media platform you may be using, those pictures are probably airbrushed and they really don't look anything like people actually look in real life. The sad news for all of us is that we all age. I am aging, you will be aging. You simply won't look the same when you're 45 as you did when you were 25. If you can embrace that process, it's going to be much easier, happier process for you than if you try to fight against every step of the way. It's better for you and for baby to breastfeed. So I would try to fight against that concern. What do you do if you've really tried breastfeeding and you're just not able to produce enough milk or any milk at all, or you have a medical condition that keeps you from passing that milk along to baby? My next video is going to deal with exactly that, healthy alternatives for moms who can't breastfeed. Again, my name is Dr. Pamela Cunningham with happyhealthychildren.org. Our goal at happyhealthychildren.org is to help you shed today's toxic modern culture and just get back to the basics of raising the happiest, healthiest children that you can. Please subscribe to our YouTube channel so that our new releases will come to your inbox as they're released. And have a great day. Thank you so much for joining us.